Today I will be talking about depression, the different approaches to treating depression, and some of the positives and negatives which stem from these methods of treatment. So, what is depression? Depression is a mental health disorder that leads to a person feeling loss of satisfaction with their life, loss of pleasure, and a feeling of continuous sadness. It stems from a traumatic experience such as losing a loved one or being a victim of crime. Events in life that leave a person at a disadvantage can also trigger depression, for example, being fired from their job. This disorder can also cause damage to loved ones, as the person affected by depression may inflict some anger and sadness onto them. It is a common disorder that can affect the day-to-day life of a person regardless of their age, gender, or background. There are many distinct categories to consider, as depression can act on many distinct aspects of a person's life. As well as psychological symptoms, there are physical and social categories to think about when labeling symptoms. Some examples of psychological symptoms include a consistent low mood or sadness. This is the feeling of not looking forward to anything, and the person can always feel sad for no reason at all. The social symptoms are avoiding contact with loved ones and purposefully avoiding activities with them. Also, neglecting favorite pastimes, hobbies, and daily activities such as cleaning, taking the dog for a walk, or even showering. A person may also suffer from difficulties in their personal life to do with romantic and or non-romantic relationships. Both social and psychological symptoms snowball into creating physical symptoms such as moving or speaking more slowly. A person may sound tired or reluctant to engage in a conversation. Significant changes in weight or appetite are also significant factors of depression, as changing in eating habits signify a loss of routine, which stems from a lack of motivation. Digestive issues can also arise, such as constipation and random unexplained pains. Moving on to the several types of treatment for depression and some critiques of the methods. Firstly, we have the humanistic approach, which was developed by Carl Rogers. This approach focuses on the importance of self-discovery, personal growth, and self-fulfillment in order to improve the patient's self-image. The approach is well recognized for helping patients reach their full potential. De Carvalho, 1980, states that a therapist should empathize with a client's experience of the world and provide an environment that allows the client to move towards self-actualization, which encourages the use of methods that are presented below, as these methods help attack the core of the problem. Person-centered therapy emphasizes the importance of creating a nurturing and non-judgmental environment where individuals can express their thoughts, emotions, and experiences freely. The client is encouraged to figure out their own solutions, which is a positive as they are left with long-term solutions. A study reducing depression in the elderly using PCT by Kim and Park in 2017 found that data from the study favored person-centered care in reducing agitation, neuropsychiatric symptoms, and depression, and improving the quality of life. Gestalt therapy focuses on a client's present life challenges as opposed to their past experiences. Role playing is utilized to increase self awareness within the patient. This is also supported by research from Hansen JT in 1999, which found that group treated with HT and GHT shows statistical differences between pre-test and post-test, resulting in a decrease in depression. Secondly, the cognitive approach developed by Beck focuses on in identifying and changing negative thoughts which recur and challenge them with evidence-based reasoning. The process helps to rebuild negative thinking and puts a positive outlook on life. In cognitive behavioral therapy, CBT, individuals become aware of their automatic negative thoughts and challenge them with evidence-based reasoning. The process also allows individuals to develop healthier ways of thinking and improves mood. Beck found that depression is a cognitive disorder and not a mental disorder, meaning it hinders cognitive abilities such as thinking and problem solving, which leads to poor decision making and overall sadness due to a lack of success. CBT is also seen as more effective than drugs as it teaches the patient to deal with scenarios head on without chemicals. However, an article by Hauger and Dyke found that, according to cognitive theory, the causal pathway involving personality molds and dysfunctional beliefs applies to only some, suggesting that the theory is generalized and cannot be used to explain the entire population. Overall, the cognitive approach to treating depression presents a more structured an evidence-based method for addressing the cause of depression. Although the treatment is an effective method, a lot of patients may not have the money or motivation to attend these seminars, which limits the effectiveness of the therapy to the motivation of the patient. The biological approach explains how depression is caused by a chemical imbalance of neurotransmitters within the brain, and treatments such as antidepressants helps to reduce this imbalance. This is the most convenient form of treatment as it consists of over-the-counter treatment and can be applied instantly whilst following a prescribed course. Antidepressants work by targeting neurotransmitters such as serotonin, dopamine, and norepinephrine, which all play a role in controlling mood. Antidepressants increase the level of serotonin in the brain, which is a feel-good neurotransmitter. Thus, excessive amounts of serotonin will decrease levels of anxiety and improve mood. The drug also prevents the reuptake of serotonin, which increases its longevity and helps regulate mood for a longer period of time. Multiple studies have shown that the use of drugs for depression can help improve a person's condition. A study by Candy B et al. On the effect of psychostimulants found that, quote, there was a significant difference in the favor of psychostimulants. The 12 tests at 15.5% did not indicate a high degree of heterogeneity, unquote. Candy B et al. 2010, indicating that there is a clear effect shown when using medicinal methods of treatment. However, some may choose to use electroconvulsive therapy, which uses an electrical charge that causes cellular change in the brain, as well as chemical changes which help restore the neurotransmitter imbalance that was previously discussed. Finally, the last form of treatment comes from the psychodynamic approach developed by Sigmund Freud. This approach focuses on exploring unresolved conflicts that remain unconscious and solving issues from the past that may be the cause for depressive symptoms. This therapy creates a safe space for the patient to discuss their emotions. Techniques such as free association can be used to gain an insight into the patient's mind, as they are encouraged to speak freely about any thoughts that come to mind regardless of coherency. Dream analysis and interpretation consists of exploring what dreams the patient is experiencing and responding to them with analysis that can help resolve any issues that cause depression and how they can go about treating it. This can be used as a gateway to the unconscious, as most dreams revolve around repressed emotions and memories, both of which can hold essential information. A study by Dreesen et al. In 2009 found that the approach was significantly more effective than control conditions at post-treatment. Therefore, when testing the efficacy of short-term psychodynamic psychotherapy for depression, it implies that the therapeutic methods are effective at reducing levels of depression.